you've already seen that we can adjust the chain heights here to make things asymmetrical or tippy by moving them in or out. The other thing you could do is leave all of the chains anchored on the platform at 10, but you can shorten all of them. This will raise the base, which can be pretty useful if you want to do seated activities. So to do that, you're just going to remove the carabiner, and then Siri, I'll have you go first. She's just going to move the carabiner. First, what you saw there was taking up the slack in the arrestor, so she got room. And she's just going to move the carabiner to a higher spot on the chain. Good. And then we'll sort of lift that up. Sorry, there you go. To match, you might need to come down. Yeah, and actually what you can do there too is you might need to do this series, just go ahead and remove that arrestor from the base. Good, and then you hook all the way up there. So what you can do is by shortening the links, moving the carabiner up to the equal amount of links in all the chains. To do that, you'll have to disconnect the arrestors and the dampener. But because the chain is shorter, you shouldn't be a problem in terms of how much the platform moves. That'll allow you to do a lot of seated exercises, and we'll go over that in detail in a second. But to give you an idea, go ahead and have a seat there, Siri. That allows for some perturbations in sitting for patients who maybe can't assume a standing position, or it's not safe to do so, or more and more we're seeing research about a feed-forward approach to cervical stabilization. Siri, just to warn you, I'm going to perturb you a little here. There's some good studies that forward translations that can give a response and being seated will travel up the neck higher, can make the muscles of the neck respond in much the way we train for an ankle that was unstable or a knee that was unstable. We want to train reactions to those perturbations, those deviations the environment causes. So this is something we use in our clinic actually for a lot of post-MVA and cervical patients. We use the Shuttle Balance for sitting balance, but they could also be actually good research showing a way to train feed-forward neuromuscular control of the cervical spine. In plain terms, we always want a way to retrain cervical stabilization for our difficult neck patients after a motor vehicle accident. And this is a new approach to it. The Shuttle Balance provides the perturbation or the error signal that the nervous system needs to then learn how to adjust and react in space. So first we could do it with the eyes open to get the patient comfortable. You could see we have it raised here by increasing or shortening the links on the chain, and that's where we put the carabiner. So one of our therapists here is going to do a perturbation first with eyes open. So go ahead, Rob, when you're ready. Good. Do a couple of those, Rob. Good, and now we'll do all of these ideally with the eyes closed to remove visual feedback, and we try to be random about the timing and the excursion and the distance. Good. Now that doesn't seem like a lot of perturbation, but again, this protocol is designed to just give a slight perturbation at the neck as that movement goes up her spine into the neck. That's why we moved her to sitting. It doesn't need to be dramatic because these shouldn't cause any pain. Another alternate you could use is Rob's going to demonstrate the use of just a simple nylon strap to give either a posterior perturbation or by use of a little lever in a sec to show anterior. So same exercise, Rob, whenever you're ready. And Siri, go ahead and close your eyes. Good. Now to get forward, all he's going to do is loop around the front bar and back into the support platform eye hook so that he now gets that fulcrum, and he can, even though he's standing behind, he can give a pretty easy forward perturbation. Good. Go ahead and go a little faster with that, Rob. You might need to take up the slack first. There you go. So as you can see, with her eyes closed, she doesn't know when it's coming. As her body moves forward, her head remains in space because of inertia, and her neck muscles have to react to that, much the same way as we perturb the position of the knee with the platform when someone's standing on it, and the patient's hamstring and other muscles will have to respond about the knee. We're trying to train automatic feed-forward stabilization of the neck, and there's some fairly decent initial research about this that it's a pretty good way to decrease scaling tone as well. We're going to show the similar exercise from the front view. This could be done. There's no reason this couldn't be done in any direction. Again, it's just the more random we make the perturbation, her cervical muscles will have to respond based on what the software of her nervous system is telling her. So we're just going to show them medial and lateral. All right, whenever you're ready, Rob. Go ahead and close your eyes, sir. Now to go the other way, it's easy just to go ahead and therapists can perturb that manually. Good. You note here the therapist, even though he has contact the whole time, he's making a distinctive, quick action to provide the perturbation. Good. Again, these don't need to provide a lot of movement to get what we're trying to do at the neck. These same things could be very helpful for a patient who couldn't do standing balance or had trouble getting onto the platform.